Thank you, colleagues. We're going to move on to the next item of business, which is consideration of business motion 22527 in the name of Graham Day on behalf of the Bureau, setting out a change to today's business. It's just moving decision time. Mr Day.
Move, Presiding Officer.
Thank you very much, Minister. No member has asked to speak on the motion. Therefore, the question is that motion 22527 be agreed. Are we all agreed? Yes. We are agreed. Thank you. So we're going to turn now to topical questions. Our first question is from Ross Greer. And Ross Greer speaking, joining us remotely. Mr Greer.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to the latest World Health Organisation guidance that young people over the age of 12 should wear a mask to help prevent transmission of COVID-19.
Cabinet Secretary John Swinney.
Presiding Officer, in the light of the latest scientific and public health advice, including the World Health Organisation guidelines, the Scottish Government has, after discussion with the Education Recovery Group, updated the advice on the use of face coverings in secondary schools and on school transport. Unless specific exemptions apply, face coverings should now be worn in secondary schools by adults and pupils in corridors and confined communal areas where physical distancing is difficult to maintain. Face coverings should also be worn by all children aged 5 and over on dedicated school transport, in line with the guidance for public transport. The guidance on school reopening will be revisited to reflect this latest advice.
Ross Greer.
I thank the Cabinet Secretary for that answer, and I welcome today's announcement, though I'm unsure why it couldn't have come before schools reopened rather than 2 weeks into term. I accept that there are legitimate issues with communication and learning where masks to be worn in class, but the Government's rationale for not including classrooms in this guidance appears to be that there's greater scope for social distancing there. This is not what teachers and pupils are telling me, which is no surprise given that classrooms are no bigger than they were in March. So can I ask the Cabinet Secretary what his message is to teachers and pupils who cannot socially distance in their classrooms?
Cabinet Secretary.
Presiding Officer, the reason why the guidance has been issued today is because the public health advice has changed, and this was not the public health advice that we had when schools returned 3 weeks ago. The second point is in relation to the rationale for the approach that's been taken in classrooms, where we are not recommending that face coverings should be utilised. And that is because in the World Health Organisation guidelines, there is a very clear balancing of the public health benefits versus the potential for undermining education and learning. And in all of these questions, there is a very sensitive balance to be constructed and to be considered in that respect. And finally, the point I would address to Mr Greer's question is that the guidance from the Education Recovery Group is very clear, that in a classroom setting, teachers should be exercising 2 metres physical distancing from pupils to enable the minimisation of the risk of transmission of the virus. But of course, if individuals wish to wear face coverings, they should be free to do so at any stage in the school day.
Ross Greer.
Thank you. The National Deaf Children's Society, amongst others, have been calling for increased use of clear face masks. This will be particularly important now in schools, not just for staff, but for other pupils, so that those with hearing impairments and other additional access needs are not socially excluded. So can I ask if the Government will ensure that clear face coverings will be made available to all schools for staff and for pupils if they require them?
John Swinney.
Presiding Officer, I think the point that Mr Greer makes is a valid point, and that is why we've encouraged schools to look very specifically at the circumstances of individual children and to make sure that the needs of individual children and young people are properly taken into account in the planning for the delivery of education in the very different environment in which we are now having to operate.
Jamie Green to be followed by Claire Adamson.
Thank you. Can I give the Government the opportunity to clear up any potential confusion around this guidance? The language being used by ministers and as reported by them in the media is non-mandatory but obligatory guidance, or words to that effect. Can I just ask simply, which is it? Are these guidelines which they would like schools to follow, or mandatory regulations which they must follow? Because there is an important difference between those. If it's not compulsory, does that mean schools can choose whether or not to implement the guidance? Or if it is mandatory, who will enforce it and who will provide the PPE?
Cabinet Secretary.
Let me try to navigate my way through this, because I appreciate the complexity of the issue. The guidance that is being set out today is to be applied in all secondary schools in Scotland, without question. How that is applied in secondary schools is specified within the guidance, in that in communal areas and on school transport, these guidelines should be followed. There will, of course, be exceptions to that, where, for health reasons and the points that Mr Greer has just raised with me, where that cannot be undertaken. There will also be circumstances where young people may be concerned about wearing face coverings, and what we are trying to do is to create an approach consistent with the wider approach in Scottish education of encouraging compliance and working with individuals to secure their compliance, rather than to provide a mandatory legal force which would be, frankly, alien to many aspects of the normal working of our schools, but to ensure that individuals can take forward the guidance that is being set out by the government in a fashion that is consistent with the way in which our schools habitually operate. And I hope that gives the clarity that Mr Green seeks, because we are trying to work with schools to make sure that they are as safe as they possibly can be for children, young people and for staff.
Claire Adamson, to be followed by Ian Gray.
Thank you, Presiding Officer. And I thank the Cabinet Secretary. My main concern was around the issue of exemptions on health grounds for young people. But I was concerned to see photographs from a school in my area in the constituency of Motherwell and Wishaw in the press last week. So what comfort can parents and young people take from them to make them feel safer, given this change of direction?
Cabinet Secretary.
I think it's important that we consider this move along with the other mitigations that are part of the guidance that's already been published. And we set out in the guidance the importance of physical distancing within schools, the importance of hand hygiene, the importance of cleaning regimes, the importance of ensuring cough etiquette is followed in all circumstances. We are adding a further layer of protection through the wearing of face coverings in the circumstances that I've set out in my answer to Mr Greer's question. And there will, of course, be exemptions for young people who are unable to comply with that approach, but this is designed to take every measure based on the available public health advice to make our schools as safe as they possibly can be.
Ian Gray, to be followed by Beatrice Wishart.
Thank you very much, Presiding Officer. The WHO's advice on face covering in schools has changed, but its advice on testing is long-standing. So why can we not complement the use of face coverings in schools with regular and routine testing of staff, as the GMB trade union have argued?
Cabinet Secretary.
Well, I announced in Parliament, it must be about 2 weeks ago now, that it is possible for staff to secure testing when they are concerned about COVID, and there is a direct employer portal that enables staff to be able to access that testing, whatever their role happens to be within a school.
Beatrice Wishart, to be followed by Mark MacDonald.
Thank you, Presiding Officer. I made the case for extending guidance on face coverings last week. The government's guidance was one step behind, so schools were forced to take the initiative by themselves. And I'm glad the Education Secretary has now moved this forward. The Cabinet Secretary indicated that, I beg your pardon, can I start again? Most pupils are already familiar with wearing face coverings in public places. Is the Scottish Government advising that face coverings should be worn as soon as possible, even if the guidance won't come into effect until Monday? Cabinet
Secretary.
I would encourage the wearing of face coverings as soon as practicable by young people. Beatrice Wishart makes the fair point that we are all accustomed to wearing face coverings in a variety of different public settings, so there will be familiarity with that practice. So I certainly would encourage individuals to take that action as soon as possible, and certainly before the 31st of August.
And Mark MacDonald.
Thank you, Presiding Officer. I welcome the clarification the Cabinet Secretary gave this morning that children and young people with autism, and I note my interest as a parent of an autistic child, will be classed as exempt in relation to this. And I ask, first of all, how prescriptive he expects the exemptions to be, given the plethora of conditions that exist out there where face coverings may be difficult for young people to wear. And furthermore, can he advise what steps will be taken to ensure awareness of these exemptions to ensure that young people are not singled out for not wearing face coverings and subjected to any form of bullying?
Cabinet Secretary.
Fundamentally, Presiding Officer, I think it's important that schools who know their pupils well are able to exercise the judgment that will enable appropriate exemptions to be applied to pupils who require to have those exemptions. And I think that's best served by judgments in schools rather than by a very prescriptive list from the government. On the second point about the way in which young people are treated in these circumstances, this is a sensitive issue. Mr MacDonald raises the danger that some young people may be somehow singled out or targeted because they are not wearing face coverings. And we have to work within our schools, which our educators are doing at all times, to create an atmosphere of respect, of mutual respect for individuals, so that the difference of circumstances that individuals face can be properly respected in the way in which they participate within schools, because we want our schools to be safe, inclusive places for all children and young people within Scotland.
Thank you very much. Move on to question number 2. Emma Harper.
To ask the Scottish Government whether it will provide an update on delayed discharge into care homes.
Cabinet Secretary Jean Freeman.
The latest published information from Public Health Scotland is that 357 patients who encountered some delay in their discharge were discharged to care homes during June of this year. That's 32% of the total discharges that month. The remaining 68% were discharged back to their own homes. This compares to 33% of delayed discharges going to a care home in June 2019. Hospitals and care homes are taking 3 key steps whenever a patient is discharged from hospital. Firstly, a patient should be tested 48 hours before discharge. Secondly, they should be isolated for 14 days on arrival in the care home, regardless of the test result. And finally, at all times, a thorough risk assessment should be undertaken prior to discharge to ensure that the care home is able to provide the care required, including having suitable physical space for isolating individuals and staff available for the delivery of care and support to the resident. And last week, as members may recall, I commissioned Public Health Scotland to produce validated statistics on patients tested prior to discharge and the outcome and date of that test. That will include how many were discharged while still considered to be infectious and the rationale for that decision.
Emma Harper.
I thank the Cabinet Secretary for her answer. Can I also ask how the number of delayed discharges compared to those prior to the pandemic?
Cabinet Secretary.
So the number of delayed discharges have reduced significantly over the last few months, and at the June census, which is the latest published, validated census were that there were 808 delayed discharges for any reason or duration, compared with 1,627 in February of this year and 1,442 in June of last year. Nearly a third of all those delayed this June were complex cases, including people who lacked capacity and were waiting a court-appointed guardian.
Emma Harper.
The Cabinet Secretary will be well aware that the winter season always sees an increase in hospital admissions, and I know that work is currently being undertaken to strengthen the resilience of our Scottish Health Service. Can I ask the Cabinet Secretary what forecasting work is being done to balance the transfer of care and mitigate the impact of this on our health and social care sectors?
Cabinet Secretary.
So there are a number of steps being undertaken as part of what would be normal winter planning, but exacerbated or increased in its significance, if you like, this year because we are still in the middle of a pandemic. That does include the significant expansion of the flu vaccination programme, and in terms of our health board's work, our health board mobilisation plans, which members will recall they were asked to produce taking us through to the end of March next year. Those plans have to have been developed in consultation with the local health and social care partnerships, which include our local authorities, so that we are also looking at what additional capacity either needs to continue in terms of particularly care at home or needs to be brought in as we make those estimates. The overall objective, of course, is to treat people as close to home as possible. So part of that also includes the scaling up where it is clinically safe to do so, the Hospital at Home initiative, which has been so successfully undertaken by NHS at Lanarkshire over many years.
Thank you. Neil Findlay, to be followed by Colin Beattie.
Following the revelations by the Sunday Post and the Courier at the weekend, if the decision made to discharge all those hundreds of patients untested or COVID positive was made in March and April, if those decisions were made on clinical need of patients, the clinical need of patients, why were those same patients not discharged in February or December or January when they were likely to have become a delayed discharge case?
Jean Freeman.
So 2 points to answer Mr Finlay's question. First of all, the point of commissioning Public Health Scotland to do the work that I've just outlined is to be really clear in the data that they then produce, which will cover all our health boards. And as Mr Finlay knows, the Sunday Post article was only able to deal with some returns from some of our health boards. So part of the objective of the Public Health Scotland work is also to identify not only patients who were discharged who had had a positive COVID test, but whether or not the date on which they had that test, because that determines whether they were infectious at the point of discharge. And when we have those numbers, I hope we will have them by the end of next month. Of course, that data will be published, and we can then have further discussions with colleagues on the issues that they want to raise. The other point that Mr Finlay makes, can I remind members that on the 17th of March in this chamber, I said, we are also working closely with the Convention of Scottish Local Authorities, Health and Social Care Partnerships and Chief Officers to get a rapid reduction in delayed discharges. I have set a goal of reducing those by at least 400 by the end of this month. That was part of a statement to this Parliament which outlined at that time our understanding and expectation of the number of potential hospital cases that would have to be dealt with because of COVID-19, and the demand that we had modelled, which said that we needed to create bed space in our hospitals to deal with that, and additional intensive care space. That was all part of that work. Reducing delayed discharges has long been a policy of this government, agreed with, I'm sure, by colleagues across the chamber. What we saw in that period was additional focus by the Health and Social Care Partnerships, supported by the boards, to work through the obstacles in the way of discharge, but that in itself does not contradict the fact that it is always a clinical decision that determines whether someone is ready to discharge, and a multidisciplinary risk assessment that agrees where they should be discharged to.
Colin Beattie, to be followed by Alison Johnson.
Can I ask if the Cabinet Secretary is aware, following the reports from the Queen's Nursing Institute, if there have been issues related to delayed discharge early in the pandemic in other parts of the UK?
Cabinet Secretary.
Yes, there have, and in the regular Four Nations call that I take part in with my colleague health ministers in Wales, Northern Ireland, and with the Secretary of State, Matt Hancock, we regularly discuss what are common challenges to us all in responding to this pandemic, in terms of making sure that our NHS was prepared, in producing additional resource through the in Scotland, the NHS Louisa Jordan, the issues around PPE, which have been rehearsed in this chamber many times, and of course the situation in terms of delayed discharges and care and support that was needed in order to make sure that we had the right care at home services, supported in the way that they were needed, as well as the approach that was taken in terms of care homes. And in common with those 3 other countries, we have developed our understanding as the understanding of the virus has developed, and developed our guidance and our action accordingly.
Alison Johnson to be followed by Willie Reddy.
Thank you. On Sunday, a letter from the Cabinet Secretary and COSLA's health spokesman to Scotland's Health and Social Care Partnerships was published. And the letter revealed that the Director-General of Health and Social Care had set a target to reduce delayed discharges by 900 by the end of April. Does the Cabinet Secretary consider that this letter does constitute an intervention by government on decisions that would otherwise have been taken purely by clinicians in consultation with social work colleagues? And can she advise what consideration was given to the impact that the urging of this target may have had?
Cabinet Secretary.
No, I don't. I don't think there is any contradiction whatsoever in saying, as I have said on the 17th of March and again on the 1st of April, when I said reduce the numbers by delayed discharges in our hospitals by 500, we will continue to work towards a further reduction of 500 over the month of April, again in this chamber. There is no contradiction between this government or indeed any opposition party having a policy to reduce delayed discharges on the grounds that we all know and we all agree that staying in hospital longer than you are clinically required to do so is positively harmful, particularly to older people. There's no contradiction between having that policy, but also saying the decision, the final decision, patient by patient, about whether someone is ready to be discharged is a clinical decision, as it should be, and the decision about where they will be discharged to and the level of care and support that they will require in that exercise is a multidisciplinary risk assessment that is undertaken, yes, by social work, by the clinicians and by the resident themselves or their families or both. There is no contradiction in this at all, and so these letters are not some blinding revelation. They are simply government enacting the policy decision, but the decisions about who is discharged, when and to where remain as they always have done, clinical and multidisciplinary decisions.
Willie Rennie to be followed by Monica Lennon.
There are still big questions outstanding. The advice on asymptomatic transmission, the value of testing all the way through this pandemic, how many positive patients were sent or moved to care homes, the isolation arrangements in those care homes. All of these are big questions. Do they not lead the Health Secretary to the conclusion that we do need an early public inquiry?
Cabinet Secretary.
So Mr Rennie is right. All of these are big decisions and all of these are questions that need to be looked at and scrutinised thoroughly. And as I have said, and as the First Minister has said more than once, we know that there will need to be a public inquiry into the entire handling of this pandemic in Scotland. I expect it will be elsewhere as well. And when the time is right, then we will bring forward what we believe should be the remit of that public inquiry, and it will get underway. But right now, we are still in the middle of a pandemic. We have outbreaks, we have clusters of cases, we have testing challenges, we have a flu expansion programme, and we still have an NHS to try to remobilise whilst it does all of that additional work. This is not the point for us to take our focus away from that job, which at the end of the day is about saving lives, in order to set up a public inquiry and direct all officials into that area of work. The work we do now is important. The public inquiry will be important. And when the time is right, we will have that public inquiry.
Monica Lennon.
Thank you, Presiding Officer. It's unfair to let social workers and clinicians take the blame for this. We've all seen the letter, Cabinet Secretary. I'm going to give you another opportunity. Will you now admit that it was this government's policy that led to so many untested and infectious patients being cleared out of hospitals and placed into Scotland's care homes? Will you just admit that?
Cabinet Secretary.
Nobody, not me, not the First Minister, not any member of this government, is suggesting that clinicians or care home workers or social workers or even the patients themselves are somehow to blame for this. Not at all. No, Ms Lennon, what I am doing is explaining to you how delayed discharge in any circumstances, including in a pandemic, works. And it works on the basis of, first of all, the lead clinician for a patient, any patient, determining that they are ready to be discharged because there is no more treatment that they need in that hospital setting. And then a multidisciplinary assessment being undertaken to determine where it is best for the individual to be discharged to. One of the great improvements that we've seen during this pandemic is a widespread adoption across our health and social care partnerships of beginning that assessment much earlier than at the point when the clinician decides the discharge. So I am not in the business of blaming anyone at all. I have always been clear I am accountable for the decisions I have taken. I believe a public inquiry is the right thing to have at the right time. And right now, I am focused on making sure that I do the best possible job I can to ensure that citizens, patients, residents and our staff across the NHS are given the resources they need and are kept as safe as possible.
And Brian Whittle.
Thank you, Presiding Officer. I keep hearing this phrase, clinical decision, but the reality is a clinical decision is about the health of the patient and the patient's ability to leave hospital. It's not about the impact of COVID on a care home. We heard today that the care inspectorate were not involved in the decision-making process. So who was looking after the care homes when we brought this legislation to this Parliament?
Cabinet Secretary.
So the care home looks after the care home in terms of, let's be really clear, in terms of deciding whether or not they wish to take that person. That is a care home's decision. And some care homes closed their doors to new admissions and still do, and we ask them to do that if they've got a positive case. But in those early days, they did that themselves because they are independent providers, some private sector, some third sector, some local authority, as Mr Whittle knows. So they make those decisions, but determining whether or not the care home in question has the right nursing capacity, the right physical capacity to keep the resident, the new admission, isolated, as the guidance has said from day one, all of that is undertaken by that multidisciplinary team who, of course, are talking to the care home in question about whether or not they can meet the requirements of the resident. So that's how it works, Mr Whittle. It's not rocket science. It's really straightforward. And I know, see, the thing is, I know that you know that. I know that you know that. So I'm not quite sure what point it is you're trying to make here. But you know as well as I do the process that is gone through, because in the constituency I represent and that you cover as part of your responsibilities, we have many care homes and we know exactly how that system works with East Ayrshire Council, the local health and social care partnership. So we know how this works. It continues to work as it always has done. And the idea that there was some secret target is nonsense, because I've just read from the record in this chamber twice what I said we were going to do.
Thank you. Question number 3, Monica Lennon.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking to ensure that patients have timely access to cancer services and when cancer surgery will be restored to full capacity across all NHS boards.
Cabinet Secretary Jean Freeman.
So, from the outset of our response to the pandemic, we prioritised emergency and urgent care, including cancer services, which have remained throughout the pandemic. And while some treatment plans have changed to minimise individual risk, cancer surgery in Scotland is currently operating close to pre-COVID levels and looking to increase what it is doing. The framework for recovery of cancer surgery, which I published in June, was clear on how cancer surgery would be prioritised across Scotland. This is supported through utilisation of private sector capacity and NHS Golden Jubilee. Cancer wait time performances for Q1 was 96%, meeting the 31-day target, and 84.7% meeting the 62-day standard. Further management information that we currently hold will be validated and published later in September. Health boards are now working on local mobilisation plans to ensure timely access to services, including those in relation to cancer. And last week I announced a new national plan for cancer services to be published in the autumn, which will ensure patients continue to have swift access to treatment and care.
Monica Lennon.
I thank the Cabinet Secretary for her response, and I note today's update from the Scottish Government. They have indeed published a refreshed framework for delivery on cancer surgery, and I note that the reference to a 60% capacity has now been removed. So that appears to be a welcome change, and I think we're all grateful to those healthcare workers who were able to keep emergency cancer services running. But Cabinet Secretary, we know that there was a postcode lottery in cancer provision before COVID, and things weren't exactly going brilliantly before the pandemic hit. Can I get from the Cabinet Secretary a guarantee today that cancer surgeries will not be reduced? And can we get a date as to when they'll be restored in full capacity in all health boards?
Cabinet Secretary.
So cancer surgeries will not be reduced. In terms of the date you look for, which is an entirely reasonable date to seek, my answer to that is when we have the validated management information, that will tell me what percentage of pre-COVID level our current surgery capacity is at, and it is more than 60%. That I do know for sure, and therefore how long I think, based on what boards and the cancer teams tell me, how long I think it will be before it gets to what that situation is in September to 100%. And at that point, I'm very happy certainly to write to the member, but also if colleagues wish to bring that back to this chamber.
Monica Lennon.
Thank you, and I welcome the Cabinet Secretary's offer for a written update. But I think the full chamber would appreciate the opportunity to ask questions and get a fuller statement on this. Today, in response to the statistics published by Public Health Scotland, Macmillan have said that they're extremely concerned, and they've reminded us that for people waiting for a cancer diagnosis or to hear if they have a life-threatening illness, it's one of the worst experiences anyone can have in their life. Can the Cabinet Secretary provide an update today on how many people have missed out on cancer screenings as a result of lockdown measures so far? And for anyone who is worried at home because they have had their appointment or their treatment delayed, what is the Cabinet Secretary's message? Because I think we all have constituents in that situation, Cabinet Secretary, and what can she say to reassure them?
Cabinet Secretary.
So I completely understand what Macmillan Cancer are saying, and the new National Plan for Cancer Services that is being developed and that I will publish in the autumn is being worked through with those key stakeholders like Macmillan Cancer and Cancer Research UK, because they have such a great deal not only of expertise but of understanding in terms of how patients feel and what patients need and want. In terms of the numbers of those who missed screening, I don't have that number with me, but I'm and rather than make an approximation, I'm very happy to send it to Ms Lennon immediately after this session. She will know that we have restarted screening services with cervical screening beginning the week of the 13th of July, breast screening returned and resumed from the 3rd of August, and boards have also resumed bowel screening, colonoscopies and appointments. My advice to individual patients would always be to speak to the clinical lead of their cancer team, who is best able to advise them about their particular situation and how that team is progressing the work. And that failing, then, of course, individuals can write to me and we can assist them as best we can. But the starting point is those with the expertise and the knowledge of the individual patient and their case. And that will be the clinical lead for their team, or, in some instances, the specialist nurse.
David Torrance.
Thank you, Presiding Officer. To ask the Cabinet Secretary if she can provide an update on the framework for recovery of cancer surgery, and can I ask how this will tie in with all overall objectives of the Scottish Government's cancer strategy?
Cabinet Secretary.
Yes, it will tie in with our objectives in terms of the cancer strategy. The framework makes clear that patients are treated and listed for surgery in order of clinical priority in exactly the same way across all of NHS Scotland. And the point of doing that is to ensure that there is equity of access based on that assessment of clinical priority. And our boards are expected then to work together to ensure that patients are offered the earliest available appointment. What that might mean in some instances is that patients will not be treated in their local board area or perhaps in their local board area but not in the nearest hospital setting to where they live. And in those circumstances, we will make sure that there is support provided to the patient and to their family if they have to move any distance from what would normally be where they would expect their treatment. The National Cancer Treatment Group is overseeing all of this and making sure that that framework is being implemented, and that framework, together with the National Plan for Cancer Services and our overall cancer strategy, as Mr Torrance referenced, will be brought together, and we will make sure that they align. The objective here is to restart and increase the delivery of all these services as quickly as we can, because, as members would expect, and I know will agree, treating cancer is one of our most important priorities.
Thank you very much, and apologies to the members. There's 3 members. Point of order, Neil Findlay.
Officer, I wonder if I could ask whether you have had a request for the Cabinet Secretary for Health to make a statement on the issues that were raised in question 2. What happened in our care homes is a national scandal, and we have to get to the bottom of this, and we have to hold the government to account for decisions that it made. So can you advise whether there has been a request for a statement, and whether the Cabinet Secretary has advised whether she will come and take more questions on this very, very important issue?
Can I thank Mr Findlay for the point of order? Yes, this was raised at the Bureau earlier today. The business managers agreed to return to the subject following today's topical questions. So the business managers will consult with me later today, and Parliament will be kept informed of whether or not the Government will come back with a statement. I'll be taking it shortly. There will be a short pause before we move on to the next item of business, but that concludes topical questions.